How you doing today, Emmy?
I'm doing good. How are you?
I'm doing good. Just first off, I'll just have you introduce yourself and kind of just describe
Alright.
who you are, what you've done, jobs you've done, and then kind of go into your DSP jobs.
Yeah, so I'm Emmy Birdsfield, and I have done a lot of work with people with disabilities as a direct support professional. The most recent place I've worked at is called Vitality. It's through the company called VTC, which stands for the Vocational Training Center. And that was a dementia day hab. So specifically targeting the aging population, people who are experiencing a lot of changes in their life, and a lot of people who are starting to experience early onset dementia. And I've also worked as a direct support professional through Easter Seals, both here in Grand Forks and Fargo. And Easter Seals, I worked as more of a residential direct support professional, so I was working in the homes with the clients. Yes, and then at VTC, I've also worked in more of a community-based setting with adults that are a little younger.
Okay, like what ages?
That would be people who are out of high school to about 55-ish. There's a couple people at the Vitality portion of VTC that are a little younger than 55, but just have experienced like more progression in their ageism, I guess.
So you described the setting at Vitality. You say you work with dementia, so it's more the older population.
Yep.
And they come there all day. They're always there. They live there. Like, how's that going?
So the vocational training center is like trying to start opening up more residential care, but for now, their day hab clinics are, or not clinics, I guess, their day hab supports are more, most individuals partake in them from 8 to 4, usually. Okay. The official hours are 8 to 4:30. Some do half days. If they're overstimulated, they might do half days. It's kind of up to each person, but usually it's a normal work day for them.
Yeah. Okay.
And a lot of them identify it as going to work.
Really?
Yep.
The people who go there.
Yep. The people we support, they're so used to the routine of going to work that they still call it work. So if they're missing a day, they're saying they're missing work. Yep.
That's funny. What is your like specific interaction with them when they come to?
So I have a lot of roles. I support them in toileting them, making sure they're getting their meals, and I'd say the biggest support is getting them in the community and involved in activities that they care about. One thing I really valued working there is the role of getting them involved in activities and occupations that they value, and adapting them for what they're able to do, modifying certain activities so they can engage in it.
Okay. And so this whole interview is based around the premise of abuse with individuals that have disabilities, and so they fall under that category. I'm just curious on what would you describe abuse as?
Abuse, that's a very broad topic. Abuse can be something that is very obvious, or it can be something that's very easy to overlook. I'd say any restrictions placed on the person and anything they want to do in their daily life. The obvious mistreatment, physical abuse, mental or emotional abuse, anything that's altering the person in a negative way would be how I define abuse.
So what's the most common form then that you saw or experienced while you were working as a DSP?
I saw a lot of different forms of abuse, and I was surprised at what I saw. I've seen caregivers and other direct support professionals talk down to people. I've seen them make fun, and that is the hardest thing to see, I guess. It's the most disappointing for the profession. But some other areas more relating to neglect, I'd say. Um, like not meeting their care plan or supporting what's written in their programs. Like, for example, if there's dietary restrictions, they might be sent with something going against that will make the individual sick. So, a lot of stuff like that.
Mm-hmm. What's your role in it when you see that? Like, what actions do you have to take going forward from there?
So, I'm a mandatory reporter, which is really important because even the littlest things need to be reported. And usually there's a line of communication I have to go through. I start with QDDPs, which is Qualified Developmental Disability Professionals. They have very similar jobs, or like a job position as like a case manager or caseworker, and there's a few of those in the company too, like caseworkers. And then the higher up would be like a program supervisor, and each site at the vocational training center has a program supervisor, so we always can rely on them.
Okay. When you make a report, do you feel like it makes a difference? Do you feel that after that report's filed, it's not just tucked away in a filing cabinet, or do you actually feel like it goes up a chain, it gets looked at appropriately, and that the appropriate actions are taken if necessary?
I would say I don't feel like, in all transparency, I don't feel like the reporting does exactly what it should when it comes down to it. I think a lot of things get overlooked or lost in translation to other people. So even though I might report something or fill out an incident report for a certain individual, it will get looked at, but I will see the same thing happen again later on. So I guess maybe, especially at VTC, there might be like a little bit of communication barriers with their residential. And I know that's something that a lot of companies deal with, is like getting the information passed along to the right people in the right places that will advocate and take initiative for that.
So, kind of like building on that, how can you maybe see that like improving? How can you make that process better?
I think one thing that people are struggling with right now is there's a lack of funding, and it's creating a stressful time for people having to take on other positions' caseloads, because ultimately, like, people are getting bogged down with work and busy, and they have a lot of people to worry about and to focus on. So I think like one thing that could be improved on when it comes to working with individuals that have disabilities is really like ensuring that you are like giving everything to the individual, and that outside distractions aren't taking away from the necessary actions that need to be taken on certain reports.
It's almost just like more eyes you can get. Looking at these people will be able to pick up on those subtle hints or something that might be missed. Yeah. No, that's really good. You also have a little background in OT, since you're in OT school right now.
Yep.
So how would your experiences with abuse and working with people with disabilities, how do you see that maybe transferring over? Like, what are some of the transferable skills that you might utilize in the future?
Yeah, so there's a lot of skills relating to abuse that could transfer to both OT and PT. I'd say the biggest skill is being an advocate. That is something that's so important because in the healthcare profession, we are responsible to give these people what they need to live meaningful lives. So really advocating and paying attention to like the nonverbal and the verbal cues that people are giving us. Some people can better communicate what they want and what they desire, but it really is just important in our professions to get to know the person, get to know their mannerisms as best as we can.
Yeah. I kind of taken a shot in the dark here, but just kind of going back to the reporting aspect of it and how you don't necessarily see you don't see action taken, is almost kind of feel like checking the box from a liability aspect, and less doing them, like the reporting is not necessarily there just to help them, but just because the company needs to in order to cover their butts in court?
Yes and no.
Yeah.
I think people do genuinely care. I think sometimes it's just like hard. I think they struggle to like figure out how to get the change to occur, and supporting like so many people in all these different companies. Um, there's just a lack of proper communication, and I think it definitely is important for the companies to cover themselves and make sure that they don't get in trouble for not documenting and stuff. But I'd say for the most part, people are so compassionate and caring, but it's just communication barriers between companies that can get in the way and make it really difficult.
Yeah, and especially the people that are working closest, like you.
Right.
Those are the people that are going to care the most. Which kind of goes into the next thing as far as like how watching this abuse affects you on the personal level. Because a lot of time we think about abuse and we think about the person it's happening to, but it also affects the people who are having to deal with that situation a lot. So like, how have you handled it?
Yeah, so handling abuse, I'm a pretty emotional person, so I personally don't deal with it well. I get frustrated. I'm really trying to work on that, I guess, but I guess at the personal level, it's made me more passionate when I see abuse, and it's encouraged me to be more of a voice for these people that necessarily can't always advocate for themselves.
Is there resources through your company for the workers in case maybe they're struggling with the things that they're seeing, like to be able to get help, or is there good support systems for the workers?
I would say the higher ups in our company, or in the vocational training center company, is the best resources. They're all very understanding. And in all honesty, the abuse that I witnessed wasn't necessarily in that setting. It was more coming from their respite care to the center. So what's going on at home behind closed doors when there's not other people around witnessing.
Yeah.
So I guess like one thing that's nice about VTC is there's always eyes. There's cameras. There's other professionals working, because it's a group of us, so I'm not working one-on-one with a client without anyone else knowing what's going on. It's pretty easy to see if there's a form of abuse going on.
Yeah.
So I don't want to say abuse never occurs there, but it definitely is less because there's more eyes.
Yeah. So you mentioned respite care. Do you want to kind of define that a little bit for people who may not be familiar?
Yeah, so that is mainly working in their home setting, so where they go when they're not in a day hab or working. And so that involves like their hygiene, meals, preparing them for the next day, clothing, getting them dressed, all of those activities of daily living.
Okay. So I spent a good amount of time in a retirement home, and that's kind of how you described this situation for them a little bit. And interactions with their caregivers is kind of like where some of the biggest forms of abuse comes from. I personally have seen a lot of taking advantage of them from like a fiscal perspective, really utilizing them for the fact that they just have money. Have you seen anything like that, or have you seen any kind of financial abuse?
I have seen forms of financial abuse. I have not seen them take their money, although I would not be surprised hearing about that if that was reported. One area though financially is at the vocational training center I worked at, we really involved people in the community, and a lot of individuals like to do things such as like bowling, or going out to lunch. Those are like really big events in their day, and they're something they really value. And I've experienced people not have the ability to get their money sent. So what we do is we communicate to their caseworkers that they need money, and they communicate that to their respite care. And sometimes they don't receive their money for months. So that's months of them not engaging or participating in things that they care about. So I've seen just the lack of advocacy, I guess, or like lack of helping them get the resources they need to be successful.
Okay. Gotcha. Well, Emmy, do you have any other specific stories or anything that you would like to share, or how you?
Some stories I can think of off the top of my head regarding abuse is a woman who has a lot of inflammation in her body, and it swells up so much she needs compression socks, and without her compression socks she struggles to walk because she swells so much. And one thing was like day after day she'd come without her compression socks, and there's nothing we can do about it once she's already there swelling up. So
Yeah.
I guess that's one example of more neglect and abuse. And I've seen people not be sent with meals that meet their dietary restrictions. And I've seen people who are sent with like meals that are outdated or expired by like several years. And let's see, I think that's all I can think of off the top of my head. There's always stories, markings and bruisings. We always report those, and that's very common. And it's hard to know whether it could be a form of abuse or not, because some individuals do just bruise very easily. But I've seen like a lot of markings that look or indicate like maybe a fall that not necessarily was always reported.
Yeah. Gotcha. Before we go, do you have any advice for people who will be working with individuals that have disabilities, and just how to handle abuse in general?
Yeah, so my best advice would be really be attentive to both the little things and the big things, because abuse is really easy to overlook. Abuse can be obvious in certain settings, but in others not so much. So really it's so important to build a relationship with the people you're working with, build rapport and get to know their mannerisms, their nonverbal and their verbal, and look out for any signs, because no thing should go overlooked when it comes to this stuff.
All right. Well, thank you for your time, and we really appreciate it.
Yeah, thank you.
All right.